Okay, we're live. The Google machine tells me we are now talking to friends across Facebook and YouTube. My name is Joseph Kopser, back to you with another installment of Catalyst Talks. Today, it's medical with our 5 or 6 time repeat guests, David and Beth Hawse, doctors, pediatricians, small business owners, parents, and genuinely good people. And that includes David also. What we are going to do is spend perhaps 10 minutes in this new shortened version the last couple of weeks, or if we get Q&A from the live audience via Facebook or YouTube, we'll take it a little bit longer. Lots to talk about with the both of you. Where do you want to start? First of all, how are you doing? And what do we make sense about different states and different regions going back to work? What's the medical science behind it? How can we ensure workplace health and safety? It's great to have you back. How are you?
It's a party.
It's a couple of questions.
So
that was like an essay question with 10 parts.
Of course it is.
I think the first thing that we ought to talk about is, this inflammatory issue in pediatric patients, being that we're both pediatricians.
Yeah.
And so
that's the thing most on my own mind as I go back to work on Monday as a pediatrician is this pediatric what are they naming it now? It's pediatric multi-system inflammatory syndrome. But it's something they're seeing in 2 to 6 year olds who are COVID positive. It is similar to something called Kawasaki disease, which occurs in kids less than 5 most often, but it's a scary thing where their immune system kind of goes haywire.
While you guys are talking, I'm going to put that link out in there. So keep going.
So, but at any rate, the kids with Kawasaki end up having actually some aneurysms of their coronary arteries. So they get into very bad heart failure situations or rupture, which is sudden death. Yeah.
And what's a good web page? MedPage Today, Medscape. Are those
actually there's a good article in USA Today.
Okay.
So that explains it in lay terms, but basically both those syndromes have a lot of what we call nonspecific symptoms. So fever longer than 5 days, rash, belly pain, those sorts of things. You have 3 girls that you've raised. You know how often people get fever, rash, belly pain, fatigue.
Sure.
It's up to us pediatricians to determine when that's normal and when it's not normal. There are some lab parameters we use, but this is a new thing, and there's really not a consensus description on it. So that's going to have to be something that happens going forward. And for the most part, we've not done a lot of testing, at least in the state of Kentucky. The drive-through testing, they don't test people less than 18. Yeah. So we really don't know what the rate of COVID in kids is.
So I think the big takeaway from this is, and I think if you go back and you look at our talks from before, we've said it appears that children have not been as severely affected as adults. And I would still say that's probably true on the whole. But also, I think we've said, and if not, then we've been remiss in not saying, that the whole idea that children don't get sick with upper respiratory tract illnesses is crazy. Right. And now we're starting to see some effects from that. And I think, to me, the big thing that's going on in the country right now is as there's increasing pressure from the population, from broad swaths of the population, I think, to open up the economy, to get out of your house. We've had enough of this.
Yeah, and I think it's important to point out, I've never met anybody who says, I want to keep the shelter in place. It's just not happening. But keep going.
And that's not going to happen. And I think that the big issue then becomes, how do we manage this? How do we go forward with this? And, I thought a lot about this over the last week. And I want to talk just about some numbers and we don't know all the numbers. We don't know the true number of people that have been infected in the United States. Because I know that I've seen people that assuredly have it. There are false negative tests. There's a whole litany of issues. But there are a few numbers that I think we have to keep in mind. And there are 2 ways to basically solve this. One is to stay in your house, which we've all agreed is not going to happen. The other is to go out. And how do we do that safely? So when you look at, I think the numbers that look at healthcare workers are probably more reflective of accuracy than the general population, because I think people are more interested in seeing how, if a healthcare worker's sick, I think they're quicker to get tested. There may be a fair number potentially of healthcare workers that are asymptomatic and have never been tested. But when you look at healthcare workers—
But can I just interrupt, make sure I understand? But you're also saying it's good to look at healthcare workers, perhaps, and at least what I'm interpreting is they're actually out there in constant contact, which is the way we used to be, but
Right.
we've now protected ourselves with this shelter in place.
Right.
Is that the right way? Okay.
And if you look at the number of cases in healthcare workers and the percentage of those people that get hospitalized and the percentage of those people that die, it's interesting because back in February I looked, and I may have talked about it. I think I talked about it on one of these.
We've been on here so many times now, we don't know who we've told what.
That if you look at in China, and the numbers in China I don't think are terribly accurate, but just take healthcare workers. If you take the number of healthcare workers who had it in China and the number of healthcare workers that died, it was about 0.3%. Okay. When you look at our general population numbers, those numbers are really more from 3 to 5%. So my guess is that there's probably at least a 10 to 15% or 10 to 15 fold underdiagnosis in the general population.
Right. So can I, as the host, moderator, and friend, for those that have already had the math wash over them, who were told there'd be no math today, or perhaps their eyeballs have rolled, what is the takeaway from that idea of looking at the healthcare worker rates of infection?
So the takeaway is that may be more reflective of the true rates, or closer to the true mortality rates. And the importance of this is general flu is 0.1%, 0.12. When you look at these numbers, you're talking 0.3, 0.32. And those numbers, it turns out, when you look at various sets of numbers from around the world, those have been kind of similar, actually. I've seen 0.29, I've seen 0.33. And so my guess is that's the tune that we're talking about. But the big issue with this, and this is why I'm bringing this up, if you take Lexington, there are 340,000 people in Lexington.
Lexington, Kentucky, for those that don't know Lexington.
0.1% of our population is known to be positive. Okay. That leaves, in order for this to burn out, one of two things has to happen. Either 60% of the population has to get antibodies either via a vaccine, which is not available, or infection. In the short run, vaccine is not an option. So if you just look at infection, you're talking to the tune of about 240,000 people getting this infection to make it go away. If we let the natural thing happen, that would translate about 8% of those people would get admitted to the hospital, which is about 17,000 admissions. Each admission's about 11 days. That's about 188,000 hospital days. We have 1,900 beds in Lexington, hospital beds. So it would take basically 96 days of every hospital in Lexington being totally full of COVID patients with no other things going on. No car accidents, no one with cancer, no one with heart disease, no one with anything else. And so the broader point of all of this is, we have to be careful when we go out. We have to be careful.
And would you say, just so for people, because I get notes from people all across the country that watch this, that Lexington, Kentucky is indicative of just most any major city or community in the country?
I think it's a small city, not a lot of mass transit, which probably decreases the rates a little bit in Lexington. Not a lot of geographic barriers. So Lexington's kind of a sprawling community, and all of those probably help Lexington in their numbers.
It's an educated city too. There's a high number of people with bachelor's degrees. Correct. So I think they tend to understand, when the governor gets on and says, I'm telling you this because, I think there is some level of understanding there too.
I think the big issue with all of this is the healthcare system in any city whether it be Lexington or New York or anywhere else, cannot handle this if everyone just walks out and doesn't wear a mask or anything.
And licks, doorknobs and handles on their way out.
There's all the things. Heck, think 5 years ago, go to a buffet. I haven't eaten at a buffet in like 30 years, because if you watch people go through a buffet, you are bound and determined to get sick.
So what you're saying is that Golden Corral might have to change its policies,
Maybe.
and the China Pagoda restaurant, this buffet, might have to change its policies?
Correct.
Okay.
So my point in all of this is they've done some studies where we made estimates on how do masks and mask compliance affect infection rates. And it turns out that if 50% of the people you see are wearing masks, it does almost nothing.
Interesting.
Okay. If 80% of people are wearing masks, it's about a 3-fold decrease in the number of cases. Okay. Which is almost equivalent to what you see in quarantine and lockdowns.
Uh-huh.
And so
because you're physically separating, and with 2 people wearing masks, it 3-fold decreases the chances.
Right.
Everyone's keeping their cooties to themselves, if you want to say that in non-math terms.
And so the point.
And by the way, I understand cooties because in school as kids, David Hawse had cooties. I just wanted to be very clear.
There you go. So I say this because I think there are ways to safely go out, but the whole idea that we're going to go safely out and we're just not going to wear masks because it's a governmental conspiracy or it shows weakness, or it shows a lack of faith in your religion, or whatever your rationale.
And don't forget, most of the Western world has looked at the Pacific Rim, who has been wearing masks with greater frequency
here,
especially when they're traveling here. The people are like, "What's your problem? What are you scared of?
Correct.
Chicken?"
Correct.
Yeah.
And so the thing is, if you don't want the hospitals to be overrun, okay, you don't want to stay in your house all the time, then the one thing you can do is wear a mask when you're in public, convince your friends to wear masks in public, and modeling that increases the overall compliance. And if we can get 4 out of 5 people wearing a mask, it's like getting, to a large extent, it's the same thing that happens with vaccines at this point. The vast majority of kids get vaccines, and so people don't get measles. But you have to have a certain compliance in order to do that.
Right.
And, we have to, as a society, understand, we always say we're willing to do anything to be patriotic. We're doing anything to make America great. Well, one thing you can do to make America great is you can put a mask on.
Yeah. Well, I'm pulling up on this. Oh, go ahead, Beth. I want to hear from you.
I was going to say, I've said it to David, and I think I said it on here, but, my grandfather spent Christmas Eve in the Ardennes forest. I can put a mask on to go to the grocery. It's not too much about, ask not what your country can do for you, but you can do for your country. I can put a mask on. It's not that big of a deal.
Yeah.
And it's not, it's not the hill any of us should want to die on as far as the government controlling us. I mean, I'm the first to agree. I don't like to be told what to do. But if this is something I can do to help my fellow American, I'm willing to do it. Nobody likes to wear one. They're not comfortable. There's a reason I'm not a surgeon, and it's because in medical school, when you did surgery rotations, you would wear that hot, stuffy, itchy mask for 8 hours and not be able to drink or pee. And I just felt like it was like torture. It was like being on a long car trip when my dad wouldn't stop, and I couldn't imagine doing that for 30 years. So I said that I'm out. I'm not doing that. I agree. It's uncomfortable, but it's something we have to do. And we are adults, and we just need to suck it up. Which is what we call the Hawse disaster plan around here. Is you know why it stinks, but we're going to suck it up.
Yeah, I think I think the other thing just to be conscious about is there is math and science behind what people are saying to do. And I know that no one likes to go through the numbers, and I have a lot more numbers that I can give. Joseph don't want to hear them. But suffice it to say,
you can put them, or Beth can put them in the Facebook feed, and then you can put them in the YouTube feed after this is over. But keep going.
But suffice it to say, they are not pulling this mask recommendation because they have a friend who makes masks and wants to make a lot of money making masks.
Right.
Yeah.
You know, they're saying this because they want to get you out of your house. Okay. It's terrible for the economy. It's terrible for people's mental health. There's a multitude of reasons to get people out of their house. The question is, how do we do that safely without overrunning the healthcare system in a manner that more people die?
Yeah.
And the numbers that I give are, remember, my numbers that I give you are 10 times less than what the current models show. And the reason is I'm basing that on healthcare worker data and not on the general population data. If you're talking the general population data, you take my 95 days, and that's 950 days of nothing but COVID in Lexington hospitals. And that's not practical. That, you know.
Yeah. Well, I mean, and the frustration out of this that so many people are experiencing is, you know, the Washington Post just released an article today about a Texas mask manufacturer. He was the last remaining domestically provided or produced mask maker. You would think that in this era of America First that we would be producing more here. I just put the link to Washington Post in the feed for people to go take a look at it. This guy is like the epitome. If you just read his comments and you can just kind of hear it through, this guy's no wallflower. He's no, let's just say, I doubt he is an AOC fan, if that's the nicest way to say it. And yet he couldn't even convince those senior appointed officials in the administration that he had the capacity to build what they needed. And when you read the article, it is just frustrating from beginning to end about the way we've handled this.
Well,
so,
it's really frustrating for me, who's walking into rooms with a leaky N95 that's built
right.
for a man and not for a woman's
That's right.
face, which is another point we can get into.
Yeah.
But it's super frustrating for me because there's no good reason why we shouldn't have sufficient PPE.
If you take the number of people who passed away from this, who live in nursing homes or assisted living facilities, and add to that healthcare workers, you have the lion's share of cases in the United States. And, you know, and I think a lot of it is like after 9/11, we had 300,000 families in the United States, or there were 300,000 people in the military, basically, who bore the brunt of a 10, now almost 20-year-old war. And after going repetitively again and again and again into Iraq and Afghanistan.
Yeah.
And the rest of us went and shopped.
Yep.
Yeah.
Yep.
And, you know,
the parallels are eerie. And I'll end on this note because we're getting near the 20-minute mark. I'll end on this note, which is I've got this blog I want to write. My friend and colleague who you know, Denny O'Neill, made this point the other day that people are preparing as if there's going to be a September 12th. Now, literally, there will be a September 12th. September 12th has always been kind of this return to work week in American business after people come off of long holidays and Labor Day weekends and summer travel, and they get serious once school goes back into session again. But in addition, September 12th was also the day after 9/11, in which the dust finally settled and people thought, well, that was
realize that the 9 means September.
Yes. Yes.
Okay.
You're good with math.
Clarify.
And the point being that this is not going to be a September 12th. This is a whole new way of doing things. And unless people take your advice about masks and social distancing and stay at home when necessary and all the things that medical and scientific professionals are telling us, this is going to get ugly because this doesn't care about ideology or geography or age. So anyway, take us home, Beth, with any thoughts that you have.
About attitude, right? And I am a pessimist, so I don't even know where this is coming from. But you know, you have challenges, and good things can come out of those.
Right.
Good things can come out of those. That there's some American ingenuity that we're able to work around this and figure out how to have a new normal, and that new normal may be better than the old normal.
Sure.
There's no one that says this new normal is going to be worse except our own attitude.
I will say one other thing, and I think after 9/11, there were a lot of people that slapped a yellow ribbon, magnetic ribbon on the back of their car and felt like they were doing something for the military. And maybe they were in some way, But one thing you can assuredly do is slap a mask on your face when you are doing something.
Yes.
What a great analogy, David.
For anyone who put a yellow ribbon on their car, put a mask on.
I got an idea. Let's get somebody to take those yellow ribbon magnets that have all now since faded, somehow get them to put them on their mask so that it's a twofer.
Yes.
Yes.
How about
Someone make patriotic masks, put yellow ribbons on green ribbons, whatever. Just wear a mask.
And people are, Mike Demas, a friend of mine's got a company called Emblematic Shield. And I'll put a link in here so that people can go on and order. You can custom design it to anything that you want.
Patriot.
Yeah, it's your way.
That's fabulous.
Okay. Anything else before we close out? I appreciate both of you being here.
Nope.
No.
Wonderful. Well, get back to the new normal, get back to the Hawse house there on Cooper Drive. And I look forward to staying in touch with you, not only through the week, perhaps next Saturday as well, and keep this conversation going. Thanks a lot, you guys.
Bye.
So once again, Catalyst Talks tries to present timely information in a way that allows you to re-examine the underlying assumptions for how we make decisions about the way things work. And then you take that framework and you apply the leadership and strategy necessary using facts and data and trying to keep the drama out of it. And we're going to be just fine. There will be ups and downs, certainly. But as Beth said during this point, we could come out of this new normal in a much better situation than we were before. And I'll echo David's point there at the end, which is if you ever put a yellow sticker on your car in the past, for heaven's sakes, put a mask on today. Thanks a lot for being a part of Catalyst Talks this afternoon. Look forward to seeing you as we go forward. Take care.